Anxiety is a normal response to stress and isn't always a bad thing. But when it gets to be uncontrollable or excessive to the point where it affects your quality of life, this may be indicative of an anxiety disorder. You might wonder what the difference is between feeling nervous and having an anxiety disorder, especially if you find yourself feeling nervous a lot. Generalized anxiety disorder can look a lot like regular anxiety at first, but it's characterized by unrealistic or excessive worry about everything, even things you might not even be able to name. It also lasts at least 6 months and can get in the way of daily functioning. Typical anxiety is a response to stress, and this is normal. When the stressor is over, the anxiety usually goes away. In anxiety disorders, removing the stressor or trigger doesn't always reduce the anxiety. Anxiety caused by stress doesn't generally significantly impair one's life or cause distress. If your anxiety is disrupting your quality of life, it might be time to reevaluate whether it may be an anxiety disorder. Anxiety or being anxious isn't always a bad thing. You can think of it almost as a spectrum or continuum of sorts. Sometimes it can help us prepare for things or help keep us alert in dangerous situations. It's also a normal reaction to stress, but anxiety disorders are not a typical reaction to stress. We all face uncertainty in our lives, but someone with anxiety disorder may anticipate the uncertainty and potential outcomes in a way that isn't proportionate to the actual event. An anxiety disorder is different from normal anxiety. Abnormal anxiety is defined by excessive and persistent worries that don't go away, even when there is nothing to be stressed or nervous about. With an anxiety disorder, people usually try to avoid triggering situations or things that worsen their symptoms. If you woke up one morning and you know you have a math test later that day, it's normal to be nervous or anxious about the test. Your heart might pound and your stomach might churn, and you might be thinking a lot about the test and your possible result. Once the test is over, you are likely more relaxed and physically back to normal. If you wake up one morning and for no reason are convinced that something bad will happen to a loved one, think about it all day and then continue to have intrusive thoughts about it the next day, that may be a sign of anxiety disorder. An anxiety disorder is often characterized by excessive and hard to control worry that occurs for most of the day. It might also consist of significant physical signs and anxiety like headaches, fatigue, muscle pain, trouble sleeping, digestive problems. If you are living with an anxiety disorder, know that it's treatable and manageable. With appropriate treatment, you can feel better. So it's worth it to get a correct diagnosis and subsequent treatment. If you enjoy this video, subscribe, like, share, and comment.